Hi, this is Adrian with Biz Savvy. Today we want to talk about what's going on with the healthcare industry. And from our past studies, healthcare isn't suffering from a patient shortage. It's suffering from an efficiency crisis. Doctors didn't spend a decade in school to fight insurance companies. They didn't sacrifice nights, weekends to spend with their families and have to complete charts. And they didn't dream of managing prior authorizations, chasing claims, or dealing with staff shortages. Yes, that's exactly where practices find themselves today. The question isn't whether healthcare is changing. The question is, will your practice adapt before your competitors do? Doctors should practice medicine, systems should handle everything else, right? Well, the numbers that nobody talks about is a typical single provider office, right? Front desk, say at 45 to 60,000 a year. Medical assistants, 40 to 55, billing, so on. Then you have benefits, payroll, overhead. Add another $250,000 to $300,000 in administrative costs. And here's the scary part. Many of the functions do not generate revenue. The most expensive employee in a medical office is the doctor doing the administrative work. That's where we thought about a couple things here, and the silent revenue generator is the medical scribes. If a physician's seeing 15 patients per day, 20 days per month, equals about 300 patients monthly. If a medical scribe helps increase that to 25 patients per day, that's 500 patients monthly. An increase of 200 additional patients every month. Imagine more procedures, more follow-ups, more testing, more referrals. The scribe isn't an expense. It's a revenue multiplier. Projection for 2030, and here's my projection, by the way. By 2030, 75% of medical practices will use some sort of healthcare operations platform. Why? Well, labor costs are stunning, continually rising. Insurance complexities keep increasing. Doctors want a work-life balance. Patients are demanding faster service. And with AI and automations are changing expectations. The offices have to embrace integrated operations that will scale. The offices that refuse will struggle because healthcare is no longer just a medical business, it's an operational business. And with the prior authorization nightmare, how many hours does an office spend fighting approvals? How many patients get frustrated waiting, right? How many procedures are delayed? Every hour spent arguing with insurance companies is less patient care, less revenue, more burnout, and burnout is becoming one of the greatest health threats ever. So the old model, you hire a front desk, billing clerk, scheduler, credential specialist, prior author specialist. That's 5 employees, 5 salaries, 5 benefit packages, 5 HR headaches. The new model, 1 integrated platform, 1 point of contact, multiple specialists, better accountability, and the future physician won't build a bigger staff, they'll build a smarter system. Here's a glimpse into what we see here in South Florida. Bilingual patients, complex insurance, high patient demand. What works? Having both English and Spanish support, real-time patient communication, better scheduling, faster collections, lower overhead. Miami and South Florida isn't an exception, it's the preview of what's happening. And here's the big bold prediction. Within the next 5 years, health operations platforms will become as common as an EMR system. Doctors will ask, who operates your partner? The same questions they ask, which EMR do you use? So if you're a physician listening today and you ask yourself, are you building a practice? Are you tap running an administrative company that happens to see patients? Because the practice that wins over the next decade won't necessarily have the building or the most employees or the biggest marketing budget. They will have the best systems, the best workflows, the smarter operations, and most importantly, they'll let the doctors get back to doing what they love, helping patients. The future of healthcare belongs to the practices that treat efficiency as serious as they treat medicine.